Number 10, the wrong blood type, 2003. A 17-year-old girl had been waiting 5 years for a heart and lung transplant. Her family had smuggled her into the United States just to get her on a list. They spent every year after that raising money, fighting insurance, and praying a donor would come in time. Then one day, the call came. A match was found. She was rushed into surgery at Duke University Medical Center. The operation looked like it went perfectly. Then her skin started turning yellow. Her body temperature spiked. Her organs began shutting down one by one. What the surgical team never checked, not once, was whether the donor's blood type matched hers. The donor was type A. Jessica was type O. Her immune system treated the new heart and lungs like an enemy and began destroying them from the inside. For 2 weeks, doctors pumped her full of drugs trying to hold her body together long enough for a second transplant. It wasn't enough. Jessica suffered fatal brain damage and died on February 22, 2003. Multiple checkpoints existed that should have caught it. Every single one failed. Duke made triple blood type verification the new standard only after she was gone. Number 9, 3 brain surgeries on the wrong side. 2007, 3 patients, 1 hospital, 1 year. All 3 went in for brain surgery. All 3 had surgeons drill into the wrong side of their skull. The first patient came to Rhode Island Hospital in January, an elderly man who needed an operation on the right side of his brain. The surgeon opened the left, it was caught, and a second surgery was done to fix the damage from the first. The hospital reviewed the incident and made no major changes. Months later, a second patient arrived with brain bleeding. The surgeon misread the scan. Wrong side, again. Another correction surgery, another review, still nothing changed. Then November, a third patient. The drill went into the wrong side of his head for the 3rd time that year. Each of those patients woke up knowing a surgeon had put a drill into the wrong part of their brain. Each faced extra recovery, extra risk, and extra trauma. All from an error that should have been impossible after the first time. The state fined the hospital $50,000 and placed it under outside oversight. The surgeon had his license suspended for 2 months. Number 8, conscious and awake. 2006. Sherman Sizemore was a 73-year-old minister from West Virginia. He went in for routine exploratory abdominal surgery, the kind done thousands of times every day across the country. His family dropped him off and expected to pick him up a few hours later. The surgical team gave him the drug that paralyzes the body. Then they forgot the second drug, the one that actually puts you to sleep. For nearly 30 minutes, Sizemore lay on the table with his abdomen open, fully conscious, feeling everything being done to him, completely unable to move a single finger or make a single sound. He was trapped inside his own body while surgeons cut through him. Afterward, the team gave him a memory-blocking drug and sent him home without saying one word about what had happened. He spent 2 weeks suffering through panic attacks and nightmares he couldn't explain. Then, on February 2, 2006, he killed himself. His family only found out the truth through the lawsuit. In 2019, the same thing happened to Stacy Gustafson in Colorado during a routine hernia surgery. Her IV line had silently come loose. The anesthetic spilled onto her pillow. The paralytic worked perfectly. For 35 minutes, she lay completely still while the surgeon operated, feeling every cut, unable to speak, unable to move. The team noticed the wet pillow and corrected it. She left the hospital with her hernia repaired and PTSD that still affects her every single day. Number 7, 16 items. Left inside a patient, 2009. Dirk Schroeder was 74 years old when he had surgery for prostate cancer in Cologne, Germany. The operation was declared a success. He was sent home and told to rest and recover. For months, he lived with worsening pain that nobody could explain. It kept getting worse. He went back to the hospital demanding answers. When doctors looked inside him, they found a 6-inch roll of bandage, multiple swabs, a needle, a compress, and part of a surgical mask. 16 separate pieces of equipment, all left inside his body while he spent months at home in agony, not knowing why he was suffering. 2 more surgeries had to be done just to remove what the first team forgot. Schroeder died 3 years later. His family argued that being cut open 3 times and knowing what had been done to him accelerated his death. They pursued around $127,000 in damages. Number 6, wrong leg amputated, 1995. Willie King was 52 years old and had already been through enough. He had a diseased right leg that doctors said could not be saved. Amputation was scheduled. He agreed, signed the paperwork, and prepared himself mentally for waking up with one less limb. Before surgeon Dr. Rolando Sanchez even walked into the operating room, something had already gone wrong. The wrong leg had been entered into the hospital computer, written on the OR schedule, listed on the board, shaved and prepped by staff. Every single layer of the system pointed to the wrong limb, and nobody caught it. Sanchez removed it. Willie King woke up, looked down, and realized the diseased leg was still there. The healthy one was gone. He had mentally prepared to lose one leg. He lost both. The defense argued both were diseased anyway. The surgeon received a $10,000 fine and a 6-month license suspension. The hospital settled with King for $1.15 million. Number 5, healthy woman, lost both breasts, 2007. Derry Eason was 35 years old with no history of cancer. She went in for a routine biopsy, a standard procedure to check a small tissue sample. She went home, waited for results, and got a call that changed everything. The lab report said cancer. Her doctor recommended immediate surgery. She got a second opinion. That doctor reviewed the same report and confirmed it. Acting on both doctors' advice, she had both breasts surgically removed. She woke up from surgery having lost both breasts, then found out the lab had mixed up her tissue sample with another patient's. She never had cancer. The report was never hers. Eason sued the facility and settled for $2.5 million. The woman whose sample was mixed up with hers, whose actual cancer results went missing, was never publicly identified. Number 4, wrong organ removed. 2006. An 84-year-old woman arrived at Milford Regional Medical Center in Massachusetts for a gallbladder removal, one of the most routine surgeries in medicine performed over 1 million times a year in the U.S. alone. Her family expected her home the same day. Before going in, Surgeon Patrick McEnany reviewed her lab results. He misread them. He removed her kidney instead. A healthy, functioning kidney taken from an 84-year-old woman who came in to have her gallbladder out. She woke up permanently missing an organ she was never supposed to lose, with her original problem still unresolved. McEnany was placed on 5 years of probation by the state medical board. No criminal charges were filed. Number 3, a screwdriver implanted in a spine, 2004. Arturo Iturralde needed surgery to stabilize his spine, a serious but planned procedure. His surgeon, Dr. Robert Ricketson, arrived in the operating room to find that the titanium rods required for the surgery were not there. They had not been stocked. The equipment was simply missing. Ricketson did not postpone. He looked around the room, found a regular hardware screwdriver, and snapped the handle off. Then he inserted it into Arturo Iturralde's spine. Within days, it snapped in half inside him. Iturralde woke up in agony with an unstable spine and broken hardware embedded in his body. He went through surgery after surgery trying to fix the damage. He died within 2 years. His estate was awarded $5.6 million in damages. Number 2, face set on fire. 2022. John Michael Murdoch was 52 years old and already in one of the hardest fights of his life, battling tongue cancer. He came to Oregon Health and Science University for a tracheotomy, a procedure to cut a small breathing hole in his throat. It was meant to help him get through treatment. He was awake on the table when it started. The team had cleaned his face with rubbing alcohol before the surgery, standard procedure, but they started operating before it fully dried. A surgical tool sparked. The alcohol ignited. His face caught fire while he was conscious. Murdoch was left permanently disfigured, his face scarred, his mind traumatized on top of the cancer he was already fighting. He died 6 months later. Number 1, Dr. Death, 2011. Christopher Dunch was a newly licensed neurosurgeon in the Dallas area. Patients came to him for routine back surgeries, herniated discs, spinal fusions, procedures done every day across the country. They trusted him with their spines. They woke up paralyzed or hemorrhaging, or with surgical hardware screwed into the wrong part of their body. One patient died from blood loss during a procedure that should have taken under 2 hours. Another was Dunch's own childhood friend. someone who trusted him completely, and woke up as a quadriplegic. Colleagues raised alarms immediately. Complaints were filed with hospitals. One hospital's response was to allow Dunch to quietly resign without reporting him to the national database that tracks dangerous doctors. He walked straight into the next hospital and kept operating. By the time the Texas Medical Board pulled his license in 2013, he had been practicing for 2 years and had gone through 38 patients. 33 were left permanently maimed, 2 were dead. Criminal charges came in 2015. In 2017, Dunch became one of the only physicians in American history convicted of a crime for what he did in the operating room. He was sentenced to life in prison.